Welcome today to Conversations of Hope. I am Leah Garrett. I'm the Vice President of Development and Communications for Community of Hope. This is the first of a three-part webinar that features Community of Hope's bold vision. In this series of Conversations of Hope, we have designed them to share our new strategic plan and some of our most exciting initiatives with each of you. Today's session focuses on the healthcare needs of families in our housing programs, and we're so grateful that today's session is sponsored by a valued partner of Community of Hope, City First Bank. Thank you so much. We're so excited to see so many of our funding partners, our donors, our volunteers who have signed up to join us today. We have about 50 people who have RSVP'd. I just want to give you a couple of notes about this platform. We are in a Zoom webinar format. This means that I and the other panelists and the other guests cannot see your videos. As guests, you will also remain muted throughout the panel. We are recording this webinar and we'll share a link with our guests after the event if you would like to rewatch it or to share it with others. Our program today will include introductions of our panel, an organizational overview from Kelly Sweeney McShane, our President and CEO, an overview of our housing programs, and then interviews with two of our frontline staff who are leading some of these initiatives. We will have a Q&A session at the end where your questions of Kelly and all of our panelists will be welcomed. We'll encourage you to submit your questions through the Q&A feature, which you should be able to find at the bottom of your webinar. There's a lot to look forward to in the next hour. We're so excited to see the response to today's session, and we're so grateful for the many, many supporters who have paved our way through the past 40 years. And for the donors and volunteers that we have leaned on very heavily during this tough year of 2020. Now, I am excited to introduce Kelly Sweeney McShane. She's very familiar to most, if not all of us. For over 20 years, she has boldly led Community of Hope. She's been leading boldly through the pandemic, and I'm excited for you to hear from her as she has led us through these pandemic ups and downs, and as she has helped us to implement a new strategic plan in this year.
Thanks, Leah, and welcome everyone. Thank you so much for joining us today as we start this series of Conversations of Hope. So in January of 2020, Community of Hope rolled out our new 5-year strategic plan that we spent most of 2019 on. Who knew that there'd be a pandemic thrown in for good measure in 2020? But despite COVID, Community of Hope has moved full speed ahead with all of our strategic initiatives, as well as with our bold vision and our new mission. So our mission is to improve health and to end family homelessness to make Washington, D.C. more equitable. And that mission is more important today than it ever has been before. So I'd like to take just a few minutes to provide some background information for those of you who don't know Community of Hope, as well as some updates as our strategic plan, and then I'll introduce our panelists and get into the conversation. So as you can see from this map, Community of Hope provides services throughout the city. We have 9 different locations with a 10th in progress, with a real focus on wards 5, 7, and 8, as well as our home where we grew up originally 40 years ago along Georgia Avenue and 14th Street. The purple shading on this map shows where our patients live, and then the purple dots show where there are families who've experienced homelessness that we're providing home-based case management and financial assistance for. We also are providing school-based mental health in 3 elementary schools in the district, 2 of which are in Ward 8. Overall, in 2019, we served about 16,000 people with about 350 staff. So in terms of our strategic goal, we decided to focus on 4 key goals to help us move forward in our mission. The first goal is to improve health and eliminate inequities in health outcomes in under-resourced communities. This goal, again, is even clearer these days, given the disparate and unequal outcomes for people with COVID, both infection rates as well as mortality rates. We continue to focus on providing access to medical care, to dental care, and to emotional wellness services. working with people to help improve their health, as well as building trusting and caring relationships between patients and their healthcare providers. For the first 6 months of 2020, Community Hope served about 8,500 patients in just over 24,000 visits. Now that's a little bit down from 2019, but that's solely due to COVID because we had to go quickly to telehealth and reduce visits for the initial 3 months. Since then, we have worked hard to increase our inpatient visits and particularly bringing in children who need immunizations, people with chronic disease, as well as people who are pregnant to make sure that we can see them. We have also expanded our COVID testing within the community at 2 of our different sites, 5 afternoons a week. We also decided that we really wanted to focus under our health outcome on 2 specific areas, which we're going to talk a lot more about today. The first one is to expand our emotional wellness support services. And our goal is really to make emotional wellness not as something that's stigmatized, but that's easily accessible, that's integrated into our primary medical care, that's integrated into schools, and as we'll talk about today, that's also integrated into our housing programs. We have found with COVID that there's an increased demand and need. We went quickly to providing all of our services via telehealth, and have found that that has actually worked out very well. There's a much lower no-show rate, people are staying longer, and it seems to have created a reduction of barriers to accessing this care. The other area where we decided to really focus is around maternal and child health. We know that the district has some very poor outcomes related to maternal and infant health, particularly for women of color. And this has been an area of strength for Community of Hope that we're working to really grow and expand. We start with our primary care and behavioral health integration, but then are really working to wrap pregnant parents with all the care and the love that they need. Everything from midwives who can deliver babies at Washington Hospital Center or at a freestanding birth center to care navigators. And again, you'll hear a little bit more about this afternoon. We've just added more doulas on staff. We're starting an initiative to provide free transportation for women who are pregnant. And we'll shortly be partnering to expand sonography and access to specialty care, as well as just making sure people have diapers and all the supplies that they need, as well as some home visiting support services using evidence-based models if that's what a family needs as well. I've also spent a lot of time in this area related to a capital project. Unfortunately, our Family Health and Birth Center location in Northeast DC needs to relocate in the next year and a half due to the landlord selling the current property. And so we have found a new location. We're looking to start construction in January and move in early 2022. It will allow us to maintain our birth center, expand our primary care, expand our emotional wellness, and add a small pharmacy on site. And happy to talk to other people who are interested in supporting this project. I know we have several that are on the phone with us today. So that's a lot around our first goal of improving health. Our second goal is to end family homelessness in Washington, D.C. And when people say to me, well, how do you do that? For Community of Hope, that means first that we prevent families from becoming homeless in the first place. So can we work on family mediation? Can we provide financial support? What can we do to help families stabilize before they have to enter into shelter? If there are families that do need to enter into shelter, we then provide short-term housing and temporary housing to make sure that families are safe, that they can get stabilized, and then we can help them move into their own housing as quickly as possible. And you'll hear a little bit more about that shortly. In the beginning of the first half of 2020, we served almost 840 families, which represents about 1,600 children in our housing programs. We continue to keep families safe and stably housed. We continue to help families get leased up during COVID. We continue to help families find jobs. Our third goal is one that I am most excited about. It is a new one for us. And for us, that is that we want to innovate, collaborate, and integrate in order to better serve our communities and our families. So that's a lot of very strong verbs that we're using there, but it's really about trying some new things, evaluating them, being creative, and really helping to move to the next level of what we do. Today, we're going to talk a lot about how we're integrating our health services into our housing program, and I'll provide a little more information on that in a second. We also have launched a new program to support parents who are 18 to 24 years old and experiencing homelessness. And we have in the last 6 months now hired and are working with 64 families with those young parents, looking at how do we work with them a little differently. And that will be the focus of our Conversations of Hope next week. And then last but not least, we're also looking at taking a place-based approach and working to support a community, really elevate the voices of the community and meet the needs in neighborhoods. We were pleased to be partnering with the district government and launched a Family Success Center in Ward 8 on October 1st. So stay tuned for more details about that. And then last but not least, our fourth goal, undergirding and making all of this happen, is to be a strong and sustainable organization, ensuring that we have the people, the resources, and the expertise needed to advance our work. For that, we have a very strong and dedicated board of directors, very grateful for the many partners and donors and volunteers that are joining us today. And most importantly, that we have just an incredibly dedicated and committed staff who are excellent at their work, and I'm so pleased to highlight some of them today. So that is our strategic plan. As you can tell, we are moving full speed ahead and continuing with the initiative despite everything that's been happening. So today, we're going to focus on our work to better integrate our health services within our housing programs. Community of Hope is unique in that we have these two strengths, and a lot of organizations don't. And we know that the way the system is set up, there are silos and barriers, and there's different funding sources and different entry levels. And so we're trying to think about how to break down those barriers, because we know in our families' lives, housing stability and healthcare and homelessness are integrally connected. They're not sort of separate days or separate part of the weeks. So the two initiatives we're going to focus on today are, first of all, integrating behavioral health services within the temporary shelter, as well as integrating our maternal and child health work with families who are pregnant and experiencing homelessness. Both of these initiatives are being funded by a generous grant from the Day One Fund from Jeff and Mackenzie Bezos. And I just have to say that it is incredibly a great gift to have such flexible funding that's really allowing us to be creative and try some new things. I just also want to emphasize that we are new in this work. We are still a good 6-7 months into some of these initiatives. So we're definitely learning as we go, but we were excited to share some of those learnings and what we're seeing so far as we move on to the next step. So from there, I want to introduce our amazing panel of staff who are here with us today. I think you will be inspired, as I am every day, by their expertise, by their dedication, by their compassion, and just a great fun group of people to work with. We first have Kalifia Thomas, who is a licensed independent clinical social worker. She is Senior Director for our temporary housing programs, and in a second, I'm going to hand it over to her. We next have Leslie Brettschneider, who's also a licensed independent clinical social worker. She's Associate Director of Behavioral Health Integration for Community of Hope. We also have Toali Cole, who is a licensed professional counselor, and she is a psychotherapist working within our temporary housing programs. And last but definitely not least is Nellie Rounsaville-Cooks, who has a master's in human services counseling, and she is the perinatal care coordinator working with families who are experiencing homelessness. So from there, I'm going to hand it over to Kalifia, who's going to talk a little bit about our housing programs and then move the conversation forward. Thanks, Kalifia. And Kalifia, you don't forget to unmute.
Thanks, Kelly. Community of Hope provides temporary housing for families experiencing homelessness at 3 different sites: Girard Street Family Shelter in Ward 1, Hope Apartments, and the Triumph, both of which are located in Ward 8. Before I tell you about our programs, let me tell you a little bit about how families come to us and a little bit about DC's homeless service system. For a family to receive homeless services, they must first go through Virginia Williams Family Resource Center. A family that is housed but facing homelessness will be referred to a homelessness prevention program. A family that does not have anywhere to stay for even one night is referred to a temporary housing program or shelter, such as Girard, Hope, or the Triumph. Girard and Hope are both apartment-style shelters, whereas the Triumph is a dormitory-style building. Because the Triumph is a dormitory-style facility, families do not have their own kitchen in their units. However, they do have refrigerators, and they have access to microwaves on each floor and in the dining room. All 3 programs have computer labs and community spaces for children activities as well as meetings. The primary goals of our temporary housing programs are to ensure families are safe and secure, to help each family find stable, affordable, and permanent housing within 90 days of program entry, and to increase family income and self-sufficiency. Housing stability case managers, housing specialists, and other program staff work with each family to identify their strengths, needs, barriers, and to help develop a case plan that will serve as a guide to overcome those barriers and help the family achieve housing stability. Staff and families work together to locate apartments for the family to view and apply for. In addition to helping families achieve housing stability, referrals to outside resources are made on a regular basis, depending on the needs of the family. Most of our families lease up into apartments with a family rehousing stabilization program, also known as rapid rehousing subsidy. This subsidy lasts for 12 to 18 months and provides rental assistance and case management services to families. A smaller number of our families will lease up into apartments with a permanent supportive housing or targeted affordable housing voucher. These vouchers come with longer lasting rental assistance as well as case management services. Community of Hope provides services throughout much of the homeless services continuum, with programs providing services in the homeless prevention program, temporary housing or shelter, rapid rehousing, and permanent supportive housing. And now I would like to welcome Leslie back to tell you a little bit more about our behavioral health programs.
Thanks, Kalifia. You've heard from Kelly about the importance of our integrated efforts in number 3 of our strategic plan, and I think our emotional wellness department is a really great product of this vision. We offer individual and family therapy, psychiatry, medication-assisted treatment, and case management for children and adults. Our therapists treat depression, anxiety, trauma, substance abuse, and so much more, working from a strengths-based and trauma-informed approach that maximizes client resilience and choice. In 2019, we had over 6,500 visits, and we're on track to best that this year, despite the changes COVID has brought to our service delivery. Perhaps the most unique part of our emotional wellness program, and the part of which I am the proudest, is its successful integration into existing programs. Our patients and clients lead busy and sometimes complicated lives as it is. Navigating a complex array of referrals and unanswered calls and "sorry, there's no one available right now to talk to you" messages shouldn't make getting help any harder than it already is. Stigma, lack of resources like transportation and childcare, mistrust, and fear are big enough barriers. Not being able to get access to a provider shouldn't be one. Our integration efforts are rooted in the belief that emotional wellness services should be accessible, relevant, holistic, and a part of regular life. We don't think our patients and clients should have to go somewhere else and meet new people when they can meet us right where they are. And where are they? They're in our medical clinics, they're in schools, and they're in our housing programs. Our earliest integration efforts started in our clinics. When I came on board in 2018, there were 2 behavioral health specialists. Now there are 5 of us covering all 3 clinics, plus a case manager. We work as a part of the primary care team, and in non-COVID times, that means we sit basically on the laps of medical providers, medical assistants, nurses, and care coordinators to ensure that our behavioral health support is simple, accessible, and coordinated. We engage our clients in relationships, leveraging the trust they have in their medical team, and sometimes repairing damages that other behavioral health systems and providers have done to their trust and willingness to seek support. We think there's no wrong door and no wrong time to start building a relationship with someone who talks with you about your emotional wellness, even if you might not be quite ready to see a therapist every week. Our integrated clinicians focus on maximizing single encounter visits to share valuable tools and interventions that improve emotional well-being and physical health together. Similarly, in 2018, there were no school-based clinicians. Through a partnership with the DC Department of Behavioral Health, we now have 3 clinicians in 3 DC public schools. The therapists working in schools provide individual therapy, social and emotional learning groups, and support for teachers and other school staff to help make trauma-informed decisions that benefit the health of the entire school and the community around it. Quality therapy support shouldn't be something that gets tacked on to the end of a long list of extracurricular activities that bring more stress. And I'm sure you can imagine how helpful it is for a family when the pressure of fitting one more thing in between dismissal and bedtime is gone. This brings me to our most recent integration endeavor, which you'll hear more about in a few moments from some of my colleagues. Community of Hope's housing programs and medical clinics have excelled on their own for years, providing high quality, innovative services and care. They did so mostly without talking to one another, as Kelly mentioned, and really, we think that's kind of silly. We realized we were missing an incredible opportunity to combine areas of expertise, reach more district residents, and provide more coordinated care. For behavioral health, this meant an integrated therapist in our transitional housing programs. We recognize the experience of homelessness as stressful and traumatic, and we recognize that it exists in concert with other stressors, financial instability, family conflict, emotional distress, and so many others. Families bring incredible resilience and strength with them, and sometimes they need reminders of this, especially when times are particularly challenging. If we apply our same theory of integration from clinics and schools to our transitional housing program, it just makes sense to have a therapist in our shelters. It makes access to high quality services easier, more coordinated with other staff, and helps our therapists be more informed about the unique challenges and opportunities that arise for families experiencing homelessness. We launched this role in June of this year alongside of an integrated perinatal care coordinator specialist, and I'm really excited for you to hear from both of these staff members about their work. So with that, I'm going to kick it back over to Kalifia for some interviews.
Thank you, Leslie. Toali, thanks for joining. I walked through how our families enter our programs, but can you tell us about the feelings and thoughts that you've heard from families when you're first connecting with them?
Of course. So I've started working with clients, with their families at various times during their stay in short-term family housing. So ranging from just having moved in 1 week prior to us meeting to having been there for 6 months. So there's about four different categories of clients' experiences that have really stuck out to me so far. So one theme that's been expressed by clients just moving into shelter, as well as clients that have been there longer, is that of emotions that come with grief and loss. So the loss of their previous housing arrangement. So their arrangement that they believe to be permanent, or their more stable housing arrangement, comes with a lot of sadness, anger, and frustration. Because having housing and shelter is such a basic and essential human need, as you can imagine, there's a lot of feelings that come along with losing that. Secondly, I've heard a lot of worries, as Leslie had pointed out earlier, about concrete life stressors that come along with experiencing homelessness. So that is, finances, finding transportation, looking for a job, working to get their families out of homelessness. So those are experiences the clients have. The third thing I've heard is themes from experiences in the past. So a lot of clients have expressed that they've experienced homelessness before in the past, or have experienced mental health in the past. So this iteration of being in short-term family housing can kind of feel like a reminder of past stress, or it can exacerbate their past mental health issues. And fourth, so a lot of the clients, the program is quite new, and the referrals I have right now have been from adult head of households, although I'll be working with full families. But the adults I've been working with, the fourth thing that they express is concerns about how this is affecting their children. So of course they want to work on their mental health so that they can support their children. They've expressed that, their children are homeschooling now because of COVID. So that combined with the transition can be a lot and can be stressful for the kids as well. So as you can imagine, that's a lot going on in their minds.
Well, yes, that is a lot. It sounds very stressful. So can you tell us how you help families to relax and maybe refocus?
Yeah. So one really important task is for clients to be able to access this relaxation and find ways to cope with stress, because a lot of their, as I spoke about, a lot of their life situations might feel out of control, or they might feel overwhelmed or stressed. So to be able to tap into relaxation even in those times is really important. So one exercise that I do with clients is a simple breathing exercise that they can use whenever they're stressed to kind of help their body access a calming relaxation response. So I will talk through it, and then we can all try it together. So it's there's a 4-second inhale, a 4-second hold, and a 6-second exhale. So let's go ahead and try it together. So make sure you're sitting in a comfortable position. You may close your eyes if that's more comfortable for you. But on the count of 3, we'll inhale, and I will talk you through it. So 1, 2, 3. Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. So let's do it one more time. Inhale, 2, 3, 4. Hold, 2, 3, 4. And exhale, 2, 3, 4, 5, 6. So this is a great exercise that can kind of start clients on the path to being able to control their responses or their stress when everything feels out of control.
Thanks, Toali. I can definitely feel that just that moment allows you to gather yourself. So thank you for that. So what does client success look like? Can you tell us about a client that you've worked with that you feel that you've really helped?
Yes, definitely. So I have a client that I'm working with who is a 24-year-old male head of household. So when I started with him, he had been in short-term family housing for 3 weeks with his partner and his 2 kids. So his main issue that he expressed to me was anxiety. So he experienced what he called emotional breakdowns. He felt like nothing was going his way. He had uncontrollable worry and trouble relaxing. So a lot of the stressors that I mentioned before, like income, transportation to interviews, jobs, things like that, were really weighing down on him. So that's why he sought out mental health treatment. We've been meeting once per week, and within 4 sessions, so it was the 5th time we met. In the 4th session, he was able to learn a lot of relaxation skills, as well as build on his existing problem-solving skills. And he was able, in those first 4 sessions, to decrease his anxiety from being on the high end of the moderate level, as we assess using our anxiety scales, to being no anxiety actually on that scale. So he gained a lot of confidence in his ability to manage his anxiety. And recently, about 3 weeks ago, him and his family moved into their own permanent housing. So that was such a great moment. And he, attributes a little bit of it to being able to help with his stress as he was preparing to leave. So that was one really great outcome to see.
Awesome. Thank you for sharing it. And that's awesome for that family. So COVID-19, yes, we have to talk about it a little bit. I was going to ask you one question about it.
Yeah.
That it's affected how we provide services in some ways. Can you tell us a little bit about how you're currently working with families and how you can foresee intervening with them in the future once we're on the other side of COVID-19?
Yes, definitely. So yes, COVID has been quite a factor. And as you all heard about before, we are doing a lot of our sessions, all of our sessions by video. So I'm meeting with clients via teletherapy. So it is a lot different because there isn't that in-person contact, but it has actually turned out to be advantageous in a lot of ways, because it allows clients to meet with me using their own devices, whether it be their phone or computer, and they're able to fit it into their busy schedules. And it also allows us to connect as if we were in the same room without the worries of distancing or using masks. So there is definitely that advantage. On another note, COVID has come up in sessions, obviously, as a big stressor for for families. So of course their kids are home, they're homeschooling, so they have more roles that they're stepping into within the household, and just managing the isolation can be very stressful. I think when we're, like you said, finally on the other side, it's going to be a lot. It's going to be at least one stressor off the family's plates, and of course we'll be able to meet again. We'll be able to meet in person. So, but I think all of the stress that it's brought just underscores the importance of the families being able to access therapy at this time. So I'm happy to be part of providing that.
Thank you. Thank you so much, Toali, and thank you for participating in our panel. Next, we bring Nellie up. I just have a few questions for you, Nellie. Hi, Nellie.
Hello, how are you?
I'm doing good. So we in Housing learned that a woman in one of our programs is pregnant. How do we start the integration process with you?
Sure. So the integration process starts by advocacy from the housing case managers. So when they identify that they have a participant on their caseload that is pregnant, or she has someone in her household that is from newborn to 6 months, they would send me a referral. So there's a link or a paper referral that they would send back, fill out and send back. And then we would together collaborate to find a time that is best to connect with the client and to do that warm handoff so that I can have a conversation and do a proper intake and assessment to determine what care coordination would need to take place for that participant.
Thank you for that. So what are some of the physical needs that you have heard about or learned about from families when you've met with them?
So during this time period, I think one of the main things has been just a physical person for support to help them navigate through the stressors and through the different things in getting resources and obtaining benefits while they're at home or not able to work with their other children. Also, a lot of the moms just need the basic supplies like diapers, wipes. We provide them with cribettes as well, and we do the safe sleep training to make sure that they're aware of what they need to know and education around that to prevent any negative outcomes. But it's really those basic necessities that helps them to get jump started in terms of making sure they have successful outcomes.
Thank you for that.
Mm-hmm.
So can you tell us about a client that you've worked with that you feel that you really helped? Tell us maybe about some of what they were experiencing and what interventions you used to serve them.
Sure, I can think of two that have really benefited from the continuum of care with Community of Hope. She's in the Permanent Supportive Housing Program, and she recently got connected to the Family Health and Birth Center for her prenatal care. She came to us at about 25 weeks, and she had no provider, and she had not been to any appointment at that time. All she knew was that she was pregnant. So the process started with getting her connected with the clinic and getting her really rooted with a midwife that she felt comfortable with and that she felt that she could trust in terms of making sure that she was taken care of. And then from that point, she was also connected with an employment specialist that has been helping her to look for jobs that she can do while working from home and navigating her through that process. We've also been working with her to obtain like basic community connections and resources such as WIC or SNAP for her child, because her oldest is 12 years old. So having a newborn and a 12-year-old, I think it's a bit far for the mom to, have, and the processes are much different now. So it's really just kind of like starting over for her and getting to know the processes and the systems again. So the other participant, she's pretty much done the exact same thing, but she's walked through this process, and she actually has some amazing some amazing staff members that work with her, such as the youth specialist that works with her older children that are school age. She works with an employment specialist, and she's also connected to our behavioral health services. And she has grown from the time that I started working here in March until now to a very innovative and independent, stable individual, where she's able to maintain her behavioral health and juggle being a mom and trying to start her career. So I think that's an amazing endeavor and some really great outcomes to see.
Thank you for sharing that. And you really did a wonderful job of highlighting how well integration can work and the impact that it can have. So thank you. Now, lastly, what does a normal day look like for you?
Oh my gosh, I don't think there is a normal day. Some days I could just be in the office doing data entry. Other days it's me throwing some diapers and a crib in the back of my Camaro, and I'm going to, meet my moms at the clinic, or I'm going, to meet them at home. Really just wherever they feel comfortable to provide support for them. So it could be a day where I just have to sit on the phone and a few of my moms just need to have a conversation to get that social support, or it can be a day where I'm just completely in the field where somebody went into labor and they didn't know they were that far along. So I had to, get a car seat and drop it off at the hospital. So you never know really what you're gonna get, but I think every day is exciting.
Sounds like it. Thank you so much, Nellie. And now, Leah.
Hello, everyone. Thank you so much to our wonderful panelists. Thank you so much, Kelly, for your excellent organizational overview. Kalifia for sharing about the homelessness system and how Community of Hope fits within that. Leslie, I love hearing about all we're doing in terms of emotional wellness. Nellie and Toali, your work and your experience is rich. We are now going to invite actually all of our panelists back onto the screen. So go ahead and rejoin. And we are fielding a number of questions already coming into the Q&A. So thank you to those who are submitting questions, and we have a couple of comments too, and we'll be reading through those. I'm going to assign those just as we're talking here. We hope to chat through them for about 10 minutes. We're going to talk about questions here. So if you have a question, you may utilize the Q&A feature again at the bottom of your Zoom webinar. If you are unfamiliar with how to navigate to that and you can find the chat and you want to put it in there, that's just fine. I will look for those in there as well. They're a little harder to see, but we really appreciate that. So thank you. The first question that we have, and this one I'm going to have Kelly do. Kelly does serve on the Interagency Council for the Homeless and really keeps a track of what's happening in DC across the board. From an anonymous guest, how does Community of Hope keep track of how many of our clients and families re-experience homelessness after they are placed in more permanent housing? Good question.
Thank you. So this is actually an important thing I want to mention in our strategic plan is we also want to do a lot more data and evaluation. So we're looking regularly at numbers. So this item in particular, we look at monthly across all of our different programs. So our most up-to-date data shows that families, we're looking 1 year after they have left the program. In our homelessness prevention program, 90% of families are not entering into the shelter system. In our rapid rehousing program, 90% are not entering back into the shelter system up to 1 year later. And then in permanent supportive housing, 98% are remaining stably housed and not entering in. And what we do is we take a list of all of our families, and we actually compare them to the citywide data of who is presenting as homeless and needing access to shelter, and we're looking at that at a regular basis. So we think those results are excellent, and continue to look at them regularly to take a look at trends.
Excellent. And actually, we have another question that's very much on this topic from Gloria. Gloria, it's so nice that you're here today. I know you and I know your heart. Gloria has a friend who is experiencing homelessness and staying in various different places. How would should Gloria advise her friend to access housing? I actually think Kalifia would be an excellent person to answer this question, if you don't mind, Kalifia.
Absolutely. Thank you for your question, Gloria. So if your friend is a part of a family member, of a household, she should start at Virginia Williams Family Resource Center. There's also a shelter hotline that she can call, and that number is 202-399-7093.
And we can send that information over to you as well. I know we can email that out to you or share that with folks afterwards as well. So Rob is asking a great question here. And I think that this could be answered by a couple of us. And maybe we'll start with Kelly on this, and then we'll have some others to chime in. But what kind of barriers are there in terms of scaling and expanding our integration efforts? Are there policy issues, internal barriers, things like that? And so Kelly, we'll have you start, and then maybe we can have some of our directors there also chime in on that front.
Great. Yeah, so there are system issues. And I think one of the things we've looked at, and as you hear today, if you're a family experiencing homelessness, you have to go through central intake and then get referred to other locations. So we often might have a patient who's experiencing homelessness and need housing, but we can't offer it to them without going through that central intake. Or there might be someone who's in our housing program who needs access to healthcare. And I think Nellie is a good example where you're working with clients who are working with other healthcare providers, which is great, but then how to access those records to make sure we're getting support and having appropriate releases of information. So those are, I think, some of the barriers we're looking through. There are some financial barriers. Again, the reason we're able to do this right now is we have very flexible private funds. The way Medicaid is billed, the way maternal child health wraparound services are paid for at this point, those are significant barriers. So again, we're hoping that by doing this, proving it, evaluating, we can help overcome some of those barriers. I don't know if anybody else wants to add on to that answer as well.
Go ahead, Kalifia.
Sorry, but thank you. I would just touch on one thing that Kelly mentioned with releases of information. A potential barrier could be that a client would not want to commingle their housing and their medical care or emotional wellness. And so we respect each individual's right of choice. And so we ask clients before we make referrals, and we have conversations about what kind of communication Toali or Nellie might have with the case manager. So give some examples of things they would talk about, as well as some things that they would not talk about. And then clients have the ability to say, well, I'm okay with her sharing this information, but not this information. And so we take that very seriously.
I would add as well that shared language, shared goals, and shared priorities are a really good opportunity here, but can also be a barrier. No one would say that integration is a bad idea, but as you can imagine, different professionals have different languaging that they use, and they also have, each of us has a long list of our own individual goals and often requirements that we have to meet. And so, if I'm a medical provider and I go into a room and I have 20 minutes and my patient has brought 4 concerns, 2 of which are chronic in nature, there's not a lot of brain space to then think about, how can I get the behavioral health specialist into the room? It's the same for a case manager working with a family experiencing homelessness, right? There's so many issues. And so trying to figure out, I think, how we use the same language and how we develop what become priority shared goals. It can be a barrier. It's also an opportunity.
Great, thank you. We have about 5 more minutes, and we have a number of other questions. Thank you all for sending them in. If you keep sending them in, if we're not able to get to them, we will, as long as they're not anonymous, we'll find ways to get you answers to your questions in the next day or so, or let's give it till Monday, Tuesday. But the question from Joshua: are there any aspects of support in the area of spiritual wellness and faith? And I think that's such a great question. Community of Hope does come from the background of being founded by a faith-based organization and then functioning as a really independent nonprofit now. So Leslie, I think you have an answer for this, right?
Sure, yeah. So I think we would see spirituality or faith that someone has as a huge protective factor and as a huge resource. And what I mean by that is that it can create both internal and external resourcing for them, whether that's because they are part of a community of faith or they just understand their sort of part and place in the world as being a part of something much larger than oftentimes the things that they have on their own plate. And so specifically in the emotional wellness capacity, that would be something that we would want to explore with clients and to work through how it can best be leveraged, both what it means to them individually to support them and also maybe how it helps them fit into a community. So I think, you know, as I mentioned earlier, we're working from a perspective of strength and resilience, and faith and spirituality support that for our clients. And so we're interested in supporting that for our clients.
Thank you. Thank you. Thank you for that question. So we have I think one we can answer real quickly here from Olivia. Kalifia, would you respond to Olivia's question is about how the Virginia Williams intake system works.
Sure. I don't work at Virginia Williams, so I don't know all the details, but I can certainly give you a brief explanation, which is what I think you asked for. When a family goes to Virginia Williams, the entire family should be together unless the children are in school. So that way you can establish a household with everyone right at the onset. And what Virginia Williams is going to do are really two things. One, verify that you are a DC resident and that you have nowhere else to go. So as I said in my overview, if you have even one night where you can stay somewhere, then they will refer you to a homelessness prevention program. But if the family doesn't have anywhere to go, then they will be referred to a temporary housing program or shelter. It is also important to note that sometimes families are coming from situations where they had to quickly leave, and so they won't have documentation, so they can't really verify that they're a DC resident at that moment. Virginia Williams is able to do what's called an interim eligibility placement, and that means that they will go ahead and place the family in a shelter or a temporary housing program, and then allow the family some days of time to work on getting those documents so that they can verify that they are eligible for services.
Great, thank you, thank you. And there is actually information on our website about how you can access housing. You can just find that under the housing section on our website if you're ever interested in that. We have a couple of questions coming in that I think can be answered by a variety of our team members. And I want to turn first to Toali and Nellie on these, if you all wouldn't mind. So these are two questions from two different people, but just go ahead and briefly, if you can, talk us through what makes working at Community of Hope different than other places, question one. And then from the other participant, what would you describe as the primary obstacle that presents a challenge to successfully providing the services and supporting your clients? So Toali, would you mind going first on that one?
Sure, yeah. So I think one thing that, sets Community of Hope apart from other organizations is the experience like we're talking about today of integration. When I started in June, a lot of my colleagues I actually haven't met face to face. A lot of it has been virtual, and that sense of connection and involvement that I still feel with all my colleagues, I think is astounding, despite the fact that we're working remotely. And so I think that also has translated into the integration efforts. So a lot, with the staff at housing who are meeting with the clients for case management purposes, I think it's been really great. Like the communication has been really seamless to be able to introduce my services. So I think that's made it a lot better. So I just think that stands out like that. I think each different department puts forth so much effort to stay connected and kind of working as one big unit. So I think that sets it apart.
Excellent.
Yeah.
And then an obstacle, if there's anything that you found.
Yeah, so I think obstacles, I think sometimes, as I think Leslie had touched on briefly before, sometimes with integration with housing clients and for mental health purposes, because clients have so many different stressors and barriers going on in their life, and they have so many different case management tasks, and they are trying to be financially stable, secure housing, a lot of things on their plate. Sometimes that can get compared to also adding mental health, because sometimes feel like it's an extra, they don't want to expose both of them. I think it's also been an opportunity to, it's like I said with telehealth, I think it's been very accessible for clients to feel like they fit the appointment into their day using their devices. So I think it's been a barrier, but also opportunity to show that they can kind of seamlessly fit health into their lives and see the benefits to all of the other stressors they face.
Awesome. Thank you. Thank you for sharing that.
Yep.
Important insights. Nellie, can we pose those same two questions to you? What makes working at Community of Hope different, and any challenges that you want to speak to? I want to just recognize that we have brought both Nellie and Toali on right before and right after we started functioning completely differently in the pandemic, and they've been doing such an awesome job.
Thank you.
Go ahead, Nellie.
I think what makes Community of Hope different is that everybody really works together, and Community of Hope really embodies that family feel throughout every department. Everybody that you talk to, they're knowledgeable about their role, they're super helpful, and everybody has been so kind and personable from the day that I started until now. Like, I don't think I've met one person who was either upset about being at work or angry about their job. Everybody is really passionate about what they do and about helping their participants. Even the participants say like they feel like they're with their family when they come to Community of Hope, because it's one big happy family, and we love doing what we do. I think, unfortunately, though, one challenge working with clients is that sometimes they're reluctant to get another person or have someone else in their life to support them, and they don't want to feel like they're being abandoned or rejected if that person has to leave. So it presents itself as a barrier, because you're trying your best to provide them with services, and sometimes they don't know what's to come, so they're afraid of taking your hand and taking that leap.
Yep. And it's a big community supporting folks. That's excellent.
Mm-hmm.
Kalifia, would you want to speak to your experience in working at Community of Hope and an obstacle?
Sure. I think for me, everybody's kind of mentioned this already, but Community of Hope really does, it starts with community. Everybody is a team player, in every aspect is team based, and you definitely feel that when you walk in the door and you go to orientation. It starts with the first day of a family feeling moment. And if you haven't met Amber and gone through orientation with her, you are genuinely missing a special day. But it just in every aspect, and no position, no role, no professional is ever so high or out of touch that you can't have a conversation. Any day that I feel that I want to walk into Kelly's office and have a conversation, I know that I'm welcome to do that. And so I don't think that feel is a lot of places. I've personally told Kelly how special I feel being a woman of color, with the amount of support and just the diversity and equity and inclusion that Community of Hope really believes in and really responds to. And it's not just talk, it's not just words, it's real. So it's amazing. It's an amazing place to be. For me, I think one of the barriers that our clients are experiencing and that might affect how they receive services or support is trauma. we're not dealing with anyone that hasn't had some level of trauma. Just the experience of just experiencing homelessness on my side of the world is a traumatic event. And most of our clients and families have had trauma after trauma, just a lot of trauma, vicarious trauma, where they've not personally experienced it, but seen it or experienced it. So that trauma can affect how long it might take to build rapport with someone, to build that trust. And it can be a barrier, but I think as a team, we work very hard to meet our clients where they are and try to be non-judgmental and be supportive and really try to focus on what their individual needs are.
Great examples. Thank you so much. Leslie, and then we have a couple other questions that are coming into the Q&A. We're going to be just answering those through a typed, and then we'll wrap up in just a moment here. So.
I would certainly echo everything that Kalifia, Nellie, and Toali have said. I think to add maybe one thing that hasn't been talked about is to speak to Kelly's sort of number 4 point on the strategic plan of building an organization that is truly thriving. And I think the attention that goes into that, having worked at a number of other nonprofits, to Kalifia's point, like the attention that goes into building a thriving organization and caring for staff is what actually helps us to do the really good work that we're doing. And so I would say kudos to Kelly and all of our other sort of executive team for supporting us in that work. We'll do the day-to-day stuff for as long as we feel that. And I think the obstacles that everybody spoke to are real. And the only thing I would add from an emotional wellness perspective is a really intense stigma that comes for many of our clients. Many of them are women of color, and there is a lot of stigma, and that's an obstacle. And I think with relationships and with the integrated care that we have, we can start to chip away at that. But as a white woman, I recognize, my own blind spots and shortcomings in doing that work. And I'm really thankful for the diversity of Community of Hope and even these 3 women who I get to partner with.
Awesome. Well, you know what? I used to say that coming to Community of Hope, I used to say the thing I love most is how strategic we are, and other organizations haven't always been that way. Community of Hope is super strategic, but we also have a really dynamic team, and I'm so glad that you got to hear from them today. Please join me in giving them a hand very briefly as we wrap up. Yes. Just wanted to share a couple of other things with you really quickly here. We're so glad that you've been a part of this session today. We hope that it has been interesting and inspirational to you. There are more ways to get involved and to hear more. We have 2 more Conversations of Hope coming up next week at the same time, and then the following week as well. So those will be great sessions. You can learn more about those on our website. We hope you'll continue to keep Community of Hope at the front of your mind as you think about your philanthropic giving for the end of the year. Generous support is what makes a lot of the creativity and innovation that we've been able to talk about today possible. We accept gifts of stuff, and there's a list on our website. You'll get a follow-up email tomorrow with lists as well. And for our families in our holiday housing program, we will be doing a holiday cheer campaign to support them with gift cards. So there's ways to learn about that as well on our website. And we have a lot of volunteer opportunities also described, guess what, on our website, but Mentors for Children and supporting college students or high school students as they're heading into college are some of the really interesting ones that you can get involved with right away. Thank you again to Kelly and Leslie, Kalifia, Toali, and Nellie. You've done great. Thank you to all of our guests. Thank you for coming today. It's been a privilege to spend this hour with you. All right, bye-bye.